Good morning. So in the previous class we studied regarding to the that is introductions about the tuberculosis. Today we are going to deal that is meaning of tuberculosis. Here now come to the meaning of tuberculosis. Tuberculosis means it is a highly contagious and communicable disease usually spreads by droplet infection from one person to the another persons. Now come to the definition of tuberculosis. The tuberculosis is defined as it is a highly contagious and communicable disease. It is caused by the Mycobacterium tuberculosis, so the resulting or it is characterized by the severe weight loss, so the cough to more than 2 to 3 weeks, and hemoptysis and a fever is called as a tuberculosis. Now coming to the causes and risk factors. The causes and risk factors. The most important cause for the tuberculosis is Mycobacterium tuberculosis bacteria. It is responsible for causing a tuberculosis. It is discovered by the Robert Koch in the year 1882. Now, coming to the risk factors, some of the persons are there, so they were very vulnerable to get the tuberculosis infections. So those are the immunocompromised individuals. It means the persons who are having the low immunity power. And the malnutrition, so that is nutrition also takes a very important role to fight the infections. The persons who are suffering from that is malnutrition, definitely they will get that is tuberculosis infections. And alcohol and the smoking also the most important risk factor for the tuberculosis, and the obese people and physically inactivity also. So the most important that is risk factor for that is tuberculosis is exposing to a workout. So these are the causes and risk factor for the tuberculosis. Now coming to the pathophysiology of tuberculosis. Here the pathophysiology is nothing but what happens inside the body. So when Mycobacterium tuberculosis enters inside the body, so that is we call as the pathophysiology of tuberculosis. So what happens? So due to this there is biological factors. The Mycobacterium tuberculosis enters inside the lungs. What happens? It damages to the lung parenchymal cells. It causes, so that is, it makes a scar. So due to the necrotizing of this parenchymal cells, so that is we call as gone foci. Gun foci or a gun focus, it means so that is the surrounding death of the surrounding parenchymal cells. So usually caused by this the infection of the tuberculosis. The Mycobacterium tuberculosis is called as a gun foci. So then what happens? It may lead to a symptoms. So the difficulty of breathing, so that is sneezing, and the coughing, so that is with the blood, also the hemoptysis, the fever. So based on the signs and symptoms, it is diagnosed as tuberculosis. Now from the clinical manifestations, the clinical features. Clinical features are the clinical features are clinical manifestations of tuberculosis. The common symptoms of the tuberculosis are, so that is the fever, the chest pain, and the hemoptysis are the cough with so that is blood, and the severe weight loss. Okay, for that reason only in the prehistoric days it is called as a consumption or a consumption. Okay, the persons who are suffering from tuberculosis, they are not taking a proper diet, they will suffer from so that is anemia or the low HB. So for that reason, individual appears like a pale so that is pale like the pale appearance. For that reason, it is called as the white plague or the white death. Okay, so these are the important so that is clinical manifestation of tuberculosis. Now coming to the so that is complication of tuberculosis. Okay, so here we are not taking the persons who are suffering from tuberculosis, they are not taking the treatment, proper treatment means they will definitely, so they will they will have the common problems. So those includes the respiratory failure, so that is cardiac failure, so that is TB meningitis, okay, that is meningitis, the severe form of tuberculosis, and it also affects the intestinal TB and the lungs, intestinal TB and the gender tract tuberculosis and infertility. Okay, so and also the death will occur. Okay, so these are the most important complications from tuberculosis. Now come to the diagnostic study. Diagnosis. The first one is the physical examination and history taking. The physical examination and history taking is very important. So by the appearance only will diagnose the persons that are suffering from tuberculosis. Yeah, it is very important physical examination and history taking. Then next is chest X-ray. The chest X-ray. So what happens in the tuberculosis? So tuberculosis infection causes the scarring of parenchymal cells, and these are called as this gone focal. So it will appear on the X-ray. So based on this, we will diagnose the persons suffering from tuberculosis. So there is PPD test. PPD test also we call as skin test or a Motax test. So it is a purified protein derivative test. It is the most important test to diagnose tuberculosis. One of the most important, so that is hallmark sign for the tuberculosis is, so that is gone foci. It is identified by the chest X-ray. Identified by the chest X-ray. And the other diagnostic measures includes that is CT scan and the MRI. Okay, so these are the most important, so that is diagnostic measures based on this by using so that is measures will diagnose so that is tuberculosis. Now come to the treatment aspects for the tuberculosis treatment. For treating tuberculosis, it is very challenging because some people have any misconceptions about the tuberculosis and also the treatment strategy. We are the healthcare providers who should give a proper education and proper knowledge and empower so that is infected people to take a proper medications. If they are not taking proper medications, definitely they will die. So the resulting from complications of the tuberculosis. Okay, so remember that word, so that is ribs. So that is the gold standard treatment for the tuberculosis. So ripamycin, isoniazid, pyrazinamide, and ethambutol and the streptomycin. Okay, so these are the important drugs. So that is available to treat tuberculosis. But the persons who are not taking those medications, so definitely, so that is the RIP. It means rest in peace only. Okay, for that reasons, we are the healthcare providers. We should have a responsibility to treat a tuberculosis because it is not only a individual problem. It will adversely affect upon our the Indian and the world economy. So for that reasons, we are the health workers. We should take the proper, so that is the proper, so that is to give a health education to the patient and empower the patient to take a proper medications. Okay, so our most important aim is to eliminate the tuberculosis from our, so that is India and the world. Okay, so this is about the what tuberculosis. It is the management of tuberculosis. Sorry. According to the surgical management, there is no specific surgical management for the tuberculosis. And according to the nursing management, so the nursing management is very important for the persons who are suffering from tuberculosis. In the nursing management, the first and the most important, so that is treatment option is to provide the psychological support with positive reinforcement. So that is the patient are under treatment treat ಆಗ್ತದೆ. Okay, for that reason, the most important function or one of most important, so the role of nurse is to provide psychological support to the patient, So then administer the drugs as, so that is the advice by the doctors, and also the maintenance, so that is nutrition status also very important, and hydration status also very important. Okay, so all about this, that is nursing management. Now coming, so most important, the role of nurse is to provide health education to the patient. Okay, so you are giving treatment in the hospital setting when you are sending the patient to the home, back to home. So the health education is very important. So provide health education to the patient and family members regarding to the, so that is hygiene and the distance, social distance to the other persons, because it will spread after that is going back to home. That is do not spread the disease to the other people. For the reason, isolation is also very important, and also nutrition status and the personal hygiene, and so advice to the patient and family member to seek medical aid immediately, so if any discomfort is felt. Okay, so this is about what we call as the management of the tuberculosis. Government of India has taken, so that's more initiative about the tuberculosis. So in the previous class only, we studied regarding the National Tuberculosis Control Program, and also in the year 1962. It made revised so in the 1997 the revised national tuberculosis program, and also so there is in the 2017 to 2025 we are having the aim to eliminate tuberculosis from our country around the world. So that is started, so there is new, so there is strategy, so there is national tuberculosis elimination program. And also one most important comparison is that the Pradhan Mantri TB Mukta Abhiyan is there. Okay, so we should spread a proper knowledge to the society, and okay, so we actively participate for so eliminating so the tuberculosis from India. Okay, so this is all about what so the tuberculosis. Thank you.